With summer starting, many people are planning to travel to high altitude places. I especially get a lot of queries about Ladakh, Gulmarg. Sometimes, rarely, I've got queries about Kedarnath and Badrinath. Now, why is this a concern? Because when you travel above an altitude of 8,000 to 9,000 feet, then your body finds it difficult to adapt to the low oxygen in the atmosphere because you are not used to that. So, firstly, if at all you are planning a trip to these places, what is recommended is that you should gradually ascend. Gulmarg is safe, it's around 8,500 feet, so maybe not safe for children below 1 year, but above 1 year should be okay. But if you just check, you can check it on Google, any level higher than 8,500 feet or 9,000, don't go with younger children. Gulmarg is otherwise safe. Kedarnath, Badrinath, even the government doesn't allow children below 10. So below 10, that is completely out. For Ladakh, officially children below 1 are not allowed. Older children can go. So firstly, you should ascend slowly so that your body gets acclimatized. Acclimatized is just a term for getting your body used to it slowly. So this is not a travel blog and I haven't been to Ladakh, but what I understood is that you can either go through the Srinagar Manali route, so that gives your body chance to ascend slowly and it gets used to it. Or if you're going directly to Ladakh, then it is recommended that you stay for 1 or 2 days in one place and barely any physical activities, maybe just a small walk till the market, that's it. Just take good rest for the first 24 to 48 hours, let your body get used to it, and then after that you can ascend slowly. There are much higher altitudes in Ladakh, so the base Ladakh altitude is around 9,000 plus, and then there is this Pangong Lake and Rohtang Pass, which are close to 13,000 feet. Kedarnath, Badrinath are close to 11,000 feet. So yeah, these are much higher altitude. So if you're going there, ascend slowly. Maybe, today if you are in Leh, then some place which is just a bit higher than Leh the next day. I mean, as I said, I am not aware of that place, but do it slowly. Let your body get adapted with it. Prior to travel, even for adults, I would strongly recommend to meet your physicians, get a detailed body checkup done, and then only travel. If you or your child are having that time cold, cough, any viral, you should postpone your plan because people with viral or cough cold tend to have more problems at a higher altitude. There is no added risk in children versus adults in terms of acute mountain sickness or other problems due to high altitude. It's just that children cannot communicate so well. So, maybe a problem that they may not be able to tell you when they start feeling the symptoms. Even children with asthma, if the asthma is well controlled, they can travel there. There is no added risk. Children with diabetes, well controlled diabetes, can travel there. But just diabetic kids, keep in mind that the glucometers you should carry, the CGM, your continuous glucose monitor, sometimes don't function well at such high altitude. So keep that in mind. Even children with seizures, if they are fine, they can travel. Children who have Down syndrome, please get a thorough checkup done because it may be a bit risky for them to go at such high altitudes, a little more riskier than other kids. So these are the few high risk children that you should keep in mind, but all children should get a basic checkup done before traveling. In case you don't have too much time to acclimatize and it's a real need that you have to go at slightly higher altitudes faster, then you can discuss with your pediatrician. Rarely we may prescribe acetazolamide to help in acute mountain sickness, but best is to slowly acclimatize the child to the altitudes. Now, when you go there, what are the symptoms you should watch out for? The first symptoms are of acute mountain sickness, headache. The child will feel dull, child will not feel like eating, will not get will be not getting proper sleep, vomitings, nausea. Some children just get continuous vomitings, and younger kids who are not able to express, they may be just very irritable, they may start looking very pale. There's nothing much to worry in acute mountain sickness if you just take a rest for 12 hours to 48 hours in the same place. In most cases it passes off, but in some cases it may progress to your cerebral edema, which is sort of like a swelling of the brain that will lead to confusion, not able to walk properly, you're completely sleeping, completely dull, not responding appropriately. That is dangerous. You need to start descent immediately and if possible show at a nearby health facility. Another complication is pulmonary edema, which is filling of water in the lungs, and that leads to breathlessness, difficulty in breathing. Your oxygen levels start dropping drastically. That is extremely dangerous. Urgently rush to the nearest facility, get oxygen, and they will start the descent. Now, at a very personal level, I feel children below 5 years should not go to these places because they cannot communicate. See, a 10-year-old child, if he's feeling a headache or he's feeling nausea, he will tell you, you can take a break, you can stay in the same place for 1 or 2 days. How will a child, 3-year-old child, express properly? And then if you keep continuing the ascent, the child may land up with pulmonary edema and cerebral edema. So at a personal level, I wouldn't recommend children below 5 years to be taken to these places. There are many other places